hear you're having some sleep problems. Is that correct? I'm sorry to hear that, and I hope we can get those addressed today. Okay? Excellent. My name is Dr. Calliope, and I'm going to be taking care of you today. I'd like to start our examination by asking some questions about the nature of your symptoms, see if we can ascertain what's going on. So first, would you mind just telling me a little bit about your symptoms? So definitely insomnia. Okay, what else? Okay, and any other symptoms that you have that may not be related to what you're coming in for today? No, okay. So when did these symptoms begin for you? Okay, and how often are you experiencing them? Okay. And how long would you say that it takes you to fall asleep? Okay. Do you snore, or do you find yourself waking up gasping at all? Gasping for air? No? Okay. And how often do you wake up at night? Okay. And when you do wake up, how long does it usually take for you to get back to sleep? And what do you do if you can't fall asleep? Do you continue to lay in bed? Do you play on your phone? Do you go read? Do you get up and leave to another room? Okay. And what have you tried to alleviate the problem? Have you tried any changes in your routine or any over-the-counter medicine, anything of that nature, any alternative therapies? Okay. Good. I'm going to ask you just a few general questions. What kind of medications are you on at present? All right, and what is that used for? Okay, and what's the dosage? And that's once a day, twice a day. Okay, anything else? All right, and any tobacco, alcohol, or recreational drug use? And I'm not asking to be a snitch or anything, but all three of these things can affect your sleep pattern and make insomnia a lot worse. Okay. Good to know. And what do your stress levels look like? And I'm not asking like how you think you should answer, but genuinely, how has life in terms of stress been lately for you? Okay. Any particular situations or events that have triggered that? Okay. And are any of the stressors more chronic or ongoing things that may not necessarily have an end in sight? Okay. So that's it for our little questionnaire here. And now we're going to be conducting an examination, and that way we can rule out any physical possibilities. So I'm going to sanitize my hands real quick. And for this examination, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful, thank you. We'll get all cleaned up. And then we'll start with a general inspection. Just take a little look at you all over. And then we'll go in a little more fine-tuned, okay? Good. So if you could just sit still for me. And I'm just going to come back a little bit, and I'm going to take a look at you. Good. So did you notice if there was any particular trigger for your insomnia, any event, perhaps the season change, or any symptoms that may have started it? I know I start having a difficult time sleeping when my allergies are really in flux. With the couple of warm days we had in the past month or so, that really had kicked up some things, huh? Very good. So I'm going to get in just a little bit closer. And let's see. Yes, I definitely see. Okay, so you have a little bit of puffiness under the eyes. How is your water intake? Just feeling around this swelling here. Okay, and what's your salt intake look like? You have a particularly salty diet or not so much? Well, it certainly wouldn't hurt to get some more water. Especially since, you mind if I see your hand real quick? I'm going to do something a little odd. So I'm just going to be pulling up the skin a little bit and letting it go. And while this isn't a definitive test, that can give me a little clue on if you are dehydrated or not. So I am very well hydrated. So when I pull up the skin, it immediately snaps back. But sometimes when we are dehydrated, should I pull that skin up a little bit, it takes a moment for it to go back down. Or sometimes it might even be a little stuck. So I'd like to just do that quick little test real quick. And should we have any other concerns with that, I can order more testing. It's no problem. Okay, so let me just pull up the skin a little bit. Let it go. Okay, so yeah, I think I definitely would like to see you drink a little bit more water. And that you most likely will not see any miracle cures to any of your symptoms, but your body does run a lot better when it is well hydrated. Think of operating a car without any oil or with very low oil. It gets very viscous and the blood tends to thicken a little bit. So if we can thin that out and everything's well lubricated, then that definitely reduces some of the issues we may have, especially because when we get dehydrated, our vision might shake, or we get headaches, or we feel general malaise, and that's not going to help anyway, okay? All right, so I'll move on from the hydration talk, and let's go ahead and take a little peek at your eyes. So I already had felt around the bit of swelling here, and I certainly see the darkness around your eyes. Is that something that you normally deal with, or has it gotten a little deeper? Okay, good to know. Yeah, I you noticed if they are dry or watery, anything of that sort? No? Okay, just tired. Do you use a lot of screens? Who doesn't, right? So that definitely could be contributing to both the insomnia and the eye strain. But we can talk a little bit about that later. So I'm going to grab a little light here, and it's going to be a little bright, okay? If you have to look away or if you have to blink a lot, don't worry about it. Okay, and I'm just going to bring this in from the side. Good, okay. Let's do that again. Yeah, eyes are a little tired. They're certainly a little tired, a little sluggish. Okay. Luckily, as awful as dealing with insomnia is, there are so many things that we can try to find some relief. On the other hand, then that does feel a little discouraging, but there are many different avenues we can go to treating it. If one thing doesn't work, we just switch to another. It just takes a little bit of patience. I know that's hard when you're already quite tired. Just bear with me a little bit. I promise I'll do my best to get this taken care of for you. So if you could just follow the light for me using only your eyes without moving your head. Just going to come in and out, in and out, in and out. Good. Let's go the other side. Follow this light using only your eyes without moving your head. In, out, in, out, in, out. Very good. Okay. So let's go ahead and take a little peek at your ears. Got my otoscope here. I'm going to pop on my speculum, nice fresh speculum, and flip on the light. So I am going to be pulling your ear up and back to straighten out the ear canal. We're going to take a look at the inside, okay? I'm going to start with this side. So just hold still for me. I'm going to pull the ear up and back. And then let's take a little peek. Okay, so ears look pretty good. I do see a little bit of erythema here, but just a little bit of patchiness with that. It's not particularly an angry red color, it's just more reddened. Okay, so cerumen content looks good. I'm not seeing any excess. Have you been having any problems with your ears as of late? No? Okay, good to know. Good to know. Let's see. So, tympanic membrane, great color, and no signs of perforation or anything else that might indicate a problem. So I'm going to go ahead and pull the otoscope out of the ear. Okay, and I'm just going to take a look at the other ear. So let's pull the ear up and back, and then take a little peek here. Okay. just a little bit of that redness. A little bit of that redness there, but overall, the canal itself is clear. Good hair distribution. Tympanic membrane is rather lovely. Okay, let me see. I might just be moving around a little bit. Just stay still as best as you can. Okay. I think your ears are looking pretty good. I don't see anything that would be contributing to your insomnia. Looks pretty healthy. So I'm just going to pull the otoscope out, put the ear back, and flip that off for a moment. So we're going to be taking a look into your nose. So I am going to be using the otoscope, but I will not be putting the speculum inside the nose. I'm just going to have you tip your head back, and I'll take a look inside each nostril. There certainly can be some problems with insomnia if we have issues with the nose. Have you had any problems with congestion, sinus issues, postnasal drip, anything of that sort? Okay. Let me look. I'm just checking on the health of the septum. The septum can certainly have an impact on sleeping. Okay, and you did say that you do not snore, correct? Okay, good to know. Go ahead and put your head back, all right? So let me just feel around the sinus cavities, okay? And just let me know if there's any pain or tenderness. Just first gonna press along the ethmoid here. Press, press. And then we'll press along the maxillary. Press, press, press. Anything feel uncomfortable? Okay, and I'm going to press along the frontal sinuses. Press, press, press. Okay, nothing there. So now I'm just going to tap, 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 tap all along the sinuses, okay? And do let me know if there's any pain or discomfort. Good. Okay. And anything with that? No. Okay. I'm just going to take a moment and jot down some notes. It's been fairly uneventful so far. I want to make sure I don't get too ahead of myself. Okay. And then we're going to take a little look at your mouth and your throat. So, got a tongue depressor at the ready. And I'm going to pop off the speculum. And I'm just going to use the light on my otoscope here. You could just open your mouth wide for me. Okay, there we go. Alright, so teeth look very healthy. I like the look of those teeth. And let's take a look at the tongue. Okay, so there's definitely scallop marks around the edges of the tongue, which can be an indicator of dehydration. Can also be an indicator that your tongue's just a little bit too big for your mouth. I unfortunately have one of those problems. It's a bit of a strange problem to have, that the meat tentacle inside your mouth's a little too big. Yeah, I shouldn't have said that, huh? Okay, now if you could just lift your tongue to the roof of your mouth for me. Good. Okay, and can you stick your tongue out outside of your mouth? Yep. Good, and can you move it to the left and to the right? And upwards and downwards. Okay, good. You can put your tongue back, and actually I am going to be pressing it down. So if you can open your mouth wide and just, there we go. Now if you could say ah for me. Okay, uvula looks good, midline. And I'm just gonna take a look down in the throat. So throat looks a touch irritated. Oh, have you had any problems with sore throats? Just in the mornings? Okay. So that might be something we keep an eye on. But if you have your heater running, oftentimes we'll get sore throats right in the morning, because our throats will be pretty dry. So, is it just in the morning then? Okay. So we'll just keep an eye on that. But otherwise, go ahead and close your mouth. Okay, so I'm going to feel around your lymph nodes, see if we have any distension in those. I'm going to start at the back of your head with the occipital, and I'm going to be moving my way forward, underneath the chin, along the throat, above the clavicle, okay? Right, so let me just feel right by the hairline here. This is generally where the occipital nodes lie for most people, at least. Okay. Good. Now I'm going to come around to just behind the ears. And this is our post-auricular nodes. Behind the ears, post. And then right in front, we have the pre-auricular nodes. And then we come underneath the jaw for the submental and submandibular. We have to do a little bit of rolling here. These ones can be kind of tricky. It is a very odd feeling when these ones are a little swollen. Okay, and now we're going to come down along the neck here. There's quite a few cervical nodes in the neck that we can feel. Okay, good. And then just above the clavicle, we have supraclavicular, or above clavicle. Okay, we're not feeling anything here either. It's good to know. That's very good. So I'm going to grab my stethoscope and we're going to do a little auscultation. I'm going to take a listen to your heart and your lungs. Have you had any problems with breathing? Any issues with your heart? Any problems with breathlessness or chest pain? No, you don't have asthma or anything like that? Okay, very good. So, we're going to start by listening to your heart. I'm going to place my stethoscope on your chest. Good. And if you could just breathe normally for me. Okay, and I'm just going to be moving this around a over here, listen to the mitral valve. Okay. Let's go ahead and take a listen to your lungs then. So when I place the stethoscope on your chest, I want you to take a deep breath in and out. Just like that, okay? Deep breath in and out. 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 Last one. Deep breath in and out. Good. Good. So I'm going to take a moment to jot some notes down, and then we're going to move on to the abdomen. Heart and lungs sounded very healthy, very strong. Take a little listen to the abdomen. We'll do auscultation first, and then we'll do palpation. Okay, so if you could just lie back for me. Okay, and just breathe normally for me. And I'm just going to be drawing the stethoscope along the abdomen here, following the tract. Have you had any digestional issues or heartburn? Acid reflux is a big one with insomnia. Okay, so no history with any of that. That's good. Acid reflux is not a fun one. Okay. And have you had any pain or tenderness in your abdomen as of late? Okay. So I am going to be palpating the abdomen. I'm going to go in first with a light pressure, and then we'll go in with a deep pressure. The deep pressure might be a little uncomfortable. It does not last very long. You just need to breathe through it. Okay? I'm going to start with the light pressure. So I'm just going to use one hand here to almost massage the abdomen. I think in any sort of casual setting, it's a little uncomfortable to have your abdomen palpated, especially since that's the one area that it's not protected by bone. I think it's an evolutionary response, very smart one. Don't let anyone get near the viscera. Okay, and I'm going to use 2 hands to do that deep pressure. Just keep breathing through it. It won't last too long. Yeah, it's not that bad, but some people feel it quite acutely, so I like to let them know. Yeah, I'm not trying to like push my hands into the spine or anything, but definitely want to get a good feel. Okay, go ahead and come back up. So lastly, I want to check your hands and more specifically your fingernails. Check the capillary refill. We'll take a look at the nails themselves. A lot of health issues can be seen in the nails. A lot of times when we first start getting ill, we see it in our hair, our skin, and our nails. So if you could just hold out your hands for me, palms to the floor. Okay. I'm just feeling the temperature of the hands and arms with the backs of my hands here. Pretty cool to the touch. The joints are warm. The hands are a little warmer. Okay, let me look at the nails. So I'm going to press down on each nail quite firmly, and then I'm going to release it, and we'll see how quickly the pink returns to the nail. Check for the circulation there. I'm just going to press, release, press, release, press, release, press, release. It's essentially instantaneous for all of your nails so far. Yeah, I'm not even almost seeing the white it turns when I press down. So, excellent circulation. Let's look at the nails themselves. So, no bangs and no dents. Color looks good and it's solid throughout the nail. The nail quality is good. It's not overly hard or brittle, rather. Why would I say bitter? Bitter in regards to nails. That's an odd choice of adjective. Yes. So certainly dry around the nail beds. But again, we're heading into winter. That's pretty much par for the course. But if you want to prevent hangnails and that dry skin around it, you can do like a little bit of nail oil or a balm around the sides. Hangnails are awful to deal with, one of the worst things about winter. But if we keep that skin moisturized, then that can help prevent a lot of it. Okay, now if you could just flip your hands over for me. Let me look at the palms. Okay, good color, good temperature, and good bulk in the muscle. Have you had any numbness or tingling with the wrist, the hands, the elbows? No? Okay. And I want to ask about your legs. Have you noticed if your legs feel like you have to move them around a lot? Okay, are you feeling any numbness or tingling in the legs? No. Do you get any sharp pains in the legs that maybe trail up the back of it and go up towards your back? Okay, so probably no sciatica or restless leg syndrome, which is good. And I'm just going to take a little peek at your feet so we can check the capillary refill again here and just take a little look, see if there's any pedal edema. So I'm just going to press down on the nails and release. Press, release, press, release, press, release, press. Good. Nail quality is good. Color's good. Let me just feel around the ankles here. Okay, it doesn't seem to be any swelling. Okay, the rest of the skin on the legs looks good, it's clear. Okay, so I think that'll just about wrap up the physical examination. So I have not found any physical causes for your insomnia, which is just part of the diagnosis when we're dealing with sleep issues. It's such a multifaceted issue that has so many different causes that we need to do just a little bit more investigation. Need just a moment. While we don't have any definitive explanations right now, on the other hand, physically, you look to be in great shape. So that is a good thing. And we'll do just a little bit more investigating, and we'll see if we can get this squirreled out for you. Okay, so what I want you to do is between now and our follow-up appointment, I'm going to have you keep a sleep diary. And I know that sounds pretty lame, but that can help us greatly with determining what exactly is going on with your sleep. And while I trust your account, sometimes when we've had something going on for so long, we can't remember the individual days, how they went, what our symptoms were like, if there's anything that set it off. So by doing this, it's a definitive guide to what's going on. So with the sleep diary, I want you to note what time you go to bed, what time you think you fall asleep, when you wake up, what your mood's like going to bed and waking up, and any other symptoms you might be having. Now, you don't have to remember all that. I have a little booklet that has many pages that give you instructions for that. So by the next time I see you, we can look through that and really pinpoint what the worst areas are and see if we can suss out something from that. Now, until then, since we don't have a concrete answer, I can give you some basic advice as far as trying to alleviate the insomnia. When we have more information, then we can target it a little bit better. But I do also want to add, if any of this works for you, note that down as well. That would be very helpful. So, when we're going to sleep, some people find that they need white noise, whether it's legitimately a white noise generator, or it's a fan, or it might be the heater that helps us go to sleep. Some people find sleep sounds or meditations to be helpful, and many people find great relief with watching ASMR videos before bed as well. So if you're able, exercise is also a great way to help wear out your body a little bit, wear down your body, I suppose I should say, and reduce any excess energy. So if you have the ability to maybe go on a walk a few hours before bed, or take some stairs, walk around the block, doesn't have to be anything substantial, but even just a 10-minute walk around the block can certainly help a lot. So if you have the ability to, even if it's something like gentle stretching or yoga, even Tai Chi, then that would have a good effect as well. So we want to avoid or limit naps during the day And I know if you're already tired and you feel like you're non-functional, you're gonna take a nap. If you cannot avoid it, then try to only snooze for maybe 45 minutes to an hour. And if possible, don't sleep at all. That little bit of sleep deprivation could be very beneficial so that when you do go to bed, then you actually go to sleep because you're exhausted. So just keep that in mind. I know sometimes it can be avoided though. Another thing we could do as far as alternative medicine goes, you could try a low dose of melatonin. It has very little health risk, negligible really. The only thing is you want a low dose. I know a lot of them give 1 milligram, 3 milligram, 5, 10. That's a lot. That's way too much. And I believe it's been said if you take too much that you make the insomnia worse. So we would start at 1 milligram at the most, and you can do that for about 2 to 3 weeks. After that, it almost becomes counter-effective, so that's just kind of a short-term thing. Another thing you could try is valerian. Valerian is an herb that's often used in sleepy time teas. So if you look on the box of the tea, these are also generally herbal in nature, so they're decaffeinated. If you check on the box, it'll often list valerian. Now, that's also a short-term thing that you could do. Valerian also has the added benefit of being like catnip for cats. So if it doesn't work for you and you have a cat, you could always just put one of the tea bags on the floor and watch your kitty go all over it. Ours would just sniff it and pretty much pass out immediately. But that's how they reacted to catnip, like weed for humans. So that's another option, in valerian. We also don't want to go to bed unless you're tired, and your bedroom should pretty much only be for sleeping. You don't want to go in there to just hang out unless it's for, like a few minutes. But only going to bed when you're sleeping, and if you are not able to fall asleep, physically leaving the room and hanging out, reading a book, doing something until you do feel sleepy would be the best course of action. If we're laying in bed and we're trying to fall asleep, oftentimes that can be counterintuitive as well. The more we try, the more it just does not happen. The more frustrated we get, the more tired we get. The cycle continues, right? Yes, yeah. So those are a few things. Obviously, avoid nicotine, avoid tobacco, alcohol, caffeine, any sort of stimulant. Even sinus medication, sometimes allergy medication, can have stimulants in them. So that may be another contributor. I know you said you didn't have any problems, but just keep that in mind. So that's a little bit of a just quick and dirty guide to trying to alleviate some of the sleep problems. If you decide to try any of these things, again, do write it down in that sleep diary, and then we can see what worked, what didn't work. Fingers crossed that they work, but if they don't, we have more information, okay? I know this was a lot. It was a lot. Is there anything I can answer for you? Any questions? Okay. I will include this information in your after visit summary as well, okay? So I know I gave you a lot. The information's in the sleep diary, and it'll also be in your summary, so you don't have to remember all of that, okay? Okay, so anything else? Anything else I can do for you? Okay, excellent. So I'd like to thank you so much for coming in to see me at the sleep clinic. I really hope that we can get this addressed for you sooner rather than later, but I have absolutely no problem continuing to work with you until we figure this out, okay? I don't want you to feel discouraged. It happens to the best of us. Insomnia is an extremely common condition. So there are many avenues we can take. Okay? All right. It was a pleasure having you. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now.
Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access to